DocTalk is brought to you by Merck Animal Health. At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.
Hey folks, welcome to DocTalk. Dr. Dan Thomson here. We're going to have a great show today. We're going to have Dr. AJ Tarpoff from Kansas State University with us. It's going to be a great show. We're going to talk about internal parasites. We're thankful that you joined us. We'll see you right after this message.
Bovolus Nasalgen 3 offers young calves unrivaled protection against devastating respiratory diseases, including IBR, PI3, and BRSV. And it has a unique blue shadow, so there's no second guessing which animals have been vaccinated. To up your protection, choose Bovolus Nasalgen 3 PMH, the first and only intranasal that protects against viral and bacterial pneumonia. Talk to your veterinarian and visit nasalgen.com to learn more.
Hey folks, welcome to DocTalk. I'm Dr. Dan Thomson and I have a friend and colleague here, Dr. AJ Tarpoff. He is an associate professor at Kansas State University and he is the state beef extension specialist or beef veterinary extension specialist for Kansas and the surrounding area. And Dr. Tarpoff has been a veterinarian in practice. He's well known in feedlot practice, beef quality assurance, cow-calf and beyond, and he really helps a lot of people. And so thanks for being with us.
No, it's always a pleasure to be here.
Great. So as we, today we're going to talk about internal parasites and, just kind of, to just get us started, just kind of help us understand who are some of the players and what are some of the things, the life cycle and how we spread it.
Yeah, so internal parasites, they're kind of that invisible attacker, right? We can see flies, we can see some of these different things, but what's lurking in our pastures that we can't see are those internal parasites. So cattle, they have a number of parasites that are specific to them, and they consume them while they graze. Okay, so these are worms. We call them worms. They're nematodes, but they consume the larvae that are out on the pasture, gets into their digestive tract, and they actually most of them live either in the abomasum, which is the acid-secreting stomach, or lower in the intestinal tract. Okay. Now the two main ones a handful of main ones that we're concerned about, that if folks are reading or they hear these names, the number one is Ostertagia.
Yep. Right.
And those of you that have heard about Ostertagia, that's the most economic parasite dealing with cattle. Another one that's on the rise is Cooperia. And we're seeing some issues with resistance, which we'll get into that. But those are two main kind of internal parasites that we're really concerned with cattle production. Now, what's interesting about these parasites is they live inside cattle, the adults do. They shed eggs, it passes through the digestive tract, goes into the environment, and those eggs are really, really stable in the environment. So what that means is they can overwinter, they stay out in the pasture, and 90% of all worm burden is not in the animals, not in our grazing cows.
It's out on the ground.
It's out on the ground. So when we treat animals, we're treating just 10% of what that population is, because the huge population of those parasites are out in the pasture. As they graze, the eggs hatch, they leave the manure pack, they get really close on the growing vegetative state of grass.
Yep.
And in the little, if you look at it under a microscope, you can see these little water droplets. Okay, and these little larvae hatch out of the eggs, they become infective, and as cattle come by, they actually consume those infective larvae.
So the other side of this is we have people that run stockers and grass cattle, and they've got cattle coming in, going out of pastures, and that. What you're saying is that even when we go and treat these animals, they're going to be seeding down these pastures with worms from all over everywhere that we're bringing onto this deal that are going to be there for a long time.
They're there. And we can't really rid an environment of those eggs. And so that's the big concern. It's there. We have to manage it. We can never completely rid these animals of it. I ran some quick numbers before I came to meet with you today.
Yeah.
One cow-calf pair that is shedding a pretty low amount of worm burden can deposit over 51 million eggs over a grazing season.
That's a lot.
Yeah.
And they don't just do it in one spot on the pasture, do they?
Nope, they carry it with them, and they know how to survive. These several of these individual parasites on the inside of cattle, they go dormant when their eggs can't survive in the environment. So if it gets really hot down south, they go dormant. Up north, guess what? Whenever it gets really cold, they go dormant, so they're not shedding eggs into an environment where they can't survive. It's called hypobiosis.
It's unbelievable.
Yep.
It's unbelievable information. We're going to take a break. When we come back, we'll talk about some of the impacts that these parasites can have on your cows. You're watching Doc Talk with Dr. Tarpoff. We're glad you joined us.
DNA Dialogue is brought to you by Igenity Beef, powered by Neogen.
I think that probably the most important trait for any commercial producer to think about when they're doing genetic selection is stayability. So stayability is how long do we expect a cow to stay in the herd, right? Our economist friends tell us that a cow has to reach this age of about 6 years old before she becomes profitable. So in that case, right, she's recouped the costs of her development, she's recouped her annual maintenance costs, and only then does that cow start to be profitable. The good news about stayability is that it's genetically heritable, right? It's one of these lowly heritable traits, so somewhere between 10 and 20% heritable, but it's probably one of the most important economic traits to a commercial cow herd. So if we can find bulls that will make cows that stay in our herd longer, we ultimately are a more profitable operation. So stayability is the most important trait for a commercial cow herd to keep their eye on.
I feel the use of genomics for cattle producers will be more widespread than we're seeing it now. I think we're just in the beginning stages of it. And I think a lot of people just see the side of the replacement females and increasing the predictability and future use of your females because we all know the cost that it takes to develop those into a cow. The large side of it that folks miss out on is the use of genomics to predict the product that they're making every year, and in that I mean their calves. The feed yards are constantly after a more predictable product, a more predictable days on feed, a more predictable outcome on the rail. Through genomics, we're able to accomplish a lot faster what used to take multiple generations.
Igenity Beef. Contact your Neogen territory manager to test today.
Angus GS powered by Neogen is the highest industry standard in genomic testing for your whole herd. Contact the American Angus Association to test today.
When you spot BRD in your cattle, that's your golden opportunity to target infection and its associated fever with a single dose of Resflor Gold, the industry standard dual therapy. To learn more, talk to your Merck Animal Health rep or your vet and see label at resflorgold.com. Animals intended for human consumption must not be slaughtered within 38 days of treatment. This product is not approved for use in female dairy cattle 20 months of age or older, including dry dairy cows.
Hey folks, welcome back to Doc Talk. Dr. Dan Thomson here with Dr. AJ Tarpoff. We're at Kansas State University where Dr. Tarpoff is an associate professor. He is the bovine veterinary extension specialist for the state of Kansas, and through the extension research, he has an unbelievable following and is a noted expert in bovine health and performance nationally and internationally. So glad to have you, and very thankful for all you do for the industry.
Yep. Well, it's fun. When people care about their animals, I want to help them. I want to help them care and do even better.
Well, another reason to send your son or daughter to K-State is he teaches some classes here as well. Mm-hmm. So great person to have as a mentor and a teacher. So we're talking about parasites. And we talked about the Ostertagia and the worm burdens and how we propagate it. Now tell me a little bit about what what it does to the animals and what we're going to see for maybe see for clinical signs.
Right. So when we think about clinical signs, we think about you can pinpoint an animal in a group and say that animal is diseased, right? When we think about bovine respiratory disease, we can pick those animals out of a group and say that one is diseased. Unfortunately, we can't do that with internal parasites always. So clinical signs, if we had true clinical signs, those are very rare. And we'll talk about that here in a minute. But our biggest burden, our biggest disease is actually subclinical issues. Okay. And that means that we can't outwardly see the issue, but we can measure it. So what happens when we get a worm burden, especially in the abomasum of cattle, what happens is they destroy the acid secreting cells inside the stomach lining.
Okay.
So when all of a sudden we have reduced acid production, that sends a feedback loop to the brain that says they're no longer hungry. So our number one issue with internal parasites is decreased voluntary feed intake. Cattle just aren't hungry. And when we're raising beef, we want animals to consume, right? We're trying to grow them. We're trying to develop them. We're trying to get them to the next stage of production. Well, if they don't want to eat food, they don't grow as well. They use more resources, takes a longer period of time. It's a huge drain on the overall cattle industry of the entire world.
Yep. And so what may show up is decreased weaning weights, decreased yearling weights, slowed heifer development, things to that nature.
Yeah, and when we slow down production, takes longer, takes too many, you mentioned heifers, they may not be cycling like they should at the right time of year, and that can catch us off guard. So it sneaks up on us, and we don't really see the outcome until we put a weight to it, until we actually measure that weight. And that's where we really see that big input. It's like, whoa, what happened?
Yep. And then if we would see some clinical signs, I'm assuming diarrhea, some of those that are like nutritionally related would be something we'd see that would be something in nature that's like a chronic type issue.
Right. So the one thing that we will see is early in the spring, after those worms that have been sleeping all winter, they kind of come out and they get really active. We can see really loose manure early in the spring. So that's really common that we can see. That's number one. Number two, heavily infected animals, they'll start to lose a lot of protein through their intestinal tract, and they'll start to gather fluid, almost like a heart failure. They'll get a bunch of fluid, and we call it bottle jaw. So they get this big water-filled sac underneath their jaw and down their neck, and that's from all that protein that they're losing through their digestive tract.
Yeah, and we see that with chronic, it'll be edema in the belly and pot-bellied and bottle jaw on that. So subclinical, clinical signs, these parasites, we got to get rid of them. It's the reason why it's a dirty word. But when we come back, we'll talk about treatment, prevention, things you can do on your farm. Dr. Tarpoff, we'll be right back.
Success in the cattle business hinges on a lot of different people playing their part. From the vet to the cowboy and the nutritionist to the feed truck driver, you rely on them to get their job done right, and so do your cattle. Your expectations for the vaccines you use should be no different. Bimeta's cattle vaccines were developed and are made and sold by men and women in the cattle business. No smoke and mirrors, just real-world protection that you can rely on. Go to bimetabiologicals.com to learn more.
CattleCon 24 is marching onward to Orlando, January 31st to February 2nd, 2024. Have your say in the future of the industry, network with fellow producers, or connect with friendly faces. Plus, the NCBA trade show will be on site with over 385,000 square feet of the latest and greatest in the cattle business to help your operation stay competitive and sustainable. Register today and learn more at convention.ncba.org.
In the livestock industry, castration is a common practice to ensure proper herd management. All methods are painful, regardless of the age of the animal. At Solvit, we could not ignore the clear industry need for better castration solutions. So we developed LidoBand, a novel lidocaine-impregnated elastrator, addressing the pain associated with band castration. It provides local anesthesia throughout the castration process. LidoBand, a small device that can make a big difference.
Hey folks, welcome back to DocTalk. Dr. Dan Thompson here with Dr. AJ Tarpoff. He is the Extension Bovine Veterinarian for the state of Kansas. He is at Kansas State University where we're at shooting today, and he is an associate professor. One of the people that is really out helping the industry and doing a lot for a lot of producers. And we're talking about internal parasites. And so, Dr. Tarpoff, when we're, talk about which animals, are the most susceptible on your farm.
Yeah, unlike other diseases where all animals are susceptible, we call it the 80-20 rule.
Okay.
So 80% of the worm burden and the infectious, carrying all that worm burden is only in 20% of our animals.
Gotcha.
So we have a relatively small number of animals carrying the vast majority and the vast burden, and really having that negative impact. So not all animals are impacted the same. Some of that is genetics, some of it's breeding, some of it's what regions they've come from, and if they've had exposure or not. So let's talk about, who is impacted most. Well, the immune system is a key player when it comes to internal parasites. So the immune system, just like any muscle, it has to be exposed to, a load, it has to work, it has to get stronger. So our young and developing calves, our younger animals, our pre-weaning, weaned animals, post-weaning, heifer development, that period of time, that growing stage, that's the most critical.
Yep.
Okay, so all animals within the herd, the younger animals.
Especially when we start to look at when they start to eat on their own, so that weaning to 2-year-old animal is just prime for parasitism.
Yeah, absolutely. So we're thinking about our stockers, our backgrounders, our post-weaning scenarios. So all of those animals are at risk. They're carrying a heavy burden. They have not had time to develop the immunity. Now, the other group that is heavily at risk, and this has to do with hormones, but bulls. Okay, our mature breeding bulls that are out in the pasture, obviously they're grazing year-round mostly, right? But those bulls, just due to the hormone levels, they're more at risk and they carry a heavier load than some of the other animals their same age.
So, on the flip side, there's some animals that are pretty darn resistant.
There are. And that's the bright and shining light, if there is one, when we talk about internal parasitism, is animals will develop resistance and develop immunity against a lot of these pathogens as they age. So when we look at something like Cooperia or Ostertagia, those internal parasites, cows, by the time they hit 3 to 4 years of age, they have a pretty robust immune response and protection against getting reinfected. So they still carry a low level, but it's not near the economic impact of what it is when they're younger.
So that kind of rolls us into, we don't have vaccines for these, but we can keep somewhat semblance of what we call refugia to help control resistance and control some of the infection rates, correct?
We can. So resistance comes at a price for some of those worms. Resistant to some of our treatment methods, it's real and it absolutely happens. So when we can keep a susceptible population out in the pasture, remember that's 90% of the population, if we can keep susceptible worms out there, we get better treatment rates whenever we go to treat them.
Right. So understanding refugia, understanding that the higher risk animals, those newly weaned calves, those stockers, those backgrounders up to 2 years old until they have enough exposure to build immune tolerance, focusing on them and maintaining some refugia to help keep that susceptible population of worms out there is vital.
Absolutely.
Great. We're going to take a break. When we come back, we'll get into what everybody wants to talk about, the product. How do I fix this problem, right? But great information. We're thankful for Dr. Tarpoff. We'll be right back.
The cost of an open cow these days is very expensive. It's hard at times to dedicate a half a day or a whole day to leave your practice to go palpate cows. And so alertness test has helped speed the process up of getting preg rates back to the owners. And so free up time for diagnostics or working in your clinic. It also will help generate revenue, not being on site to do the testing.
When a new calf hits the ground, the clock starts ticking. A belly full of colostrum gives them their best chance, but if they don't get any, time starts running out. That's when you grab a bag of Oxford Ag Colostrum in their patented feeding system. It's simple. You fill it with warm water, shake it to mix, feed it with a tube or a nipple, and you are done. No bucket, no bottle, no mess, and right on time. Ask for it by name wherever animal health supplies are sold.
When the ones who have your heart need your help, count on us for everything they deserve, delivered fast. We'll work hard for you so you can work hard for your dreams.
Hey folks, welcome back to DocTalk. Dr. Dan Thomson with Dr. AJ Tarpoff, who is the bovine veterinary extension specialist for the state of Kansas. Everything cow-calf to feedlot to stocker to backgrounder, Dr. Tarpoff handles it here at Kansas State University. And we're talking internal parasites, and we've gotten through the bugs, what they cause, which animals are more susceptible. Now let's talk about what products.
Yeah, so I guess the bad thing about products is we haven't had any new type of products or new classes of products of parasiticides in quite some time.
Right.
Okay. Now the three main classes that we have, and I'll kind of lump that into three classes. We have the avermectins,
yep,
right, which work on some of our internals, some of our externals, been around forever. They work fantastic. They're really broad spectrum. Then we have some of our other types, so our benzimidazoles, or we refer to them as white wormers.
Yep.
Those are usually drenches.
Yep.
Okay, so they've been around since the 50s. So these are products that that have been effective. We've used them in different ways, but they've been around for a long time. And then we have some of the imidazothiazoles that again can either be injectable or oral. So those are the three main categories. But again, they've been in use for a long time.
Yep.
One of the main problems that we've seen is reduced efficacy over time. And some of these products by themselves really are not knocking out those parasites like they once did.
Yep.
Now, within classes, I mentioned the white wormers, imidazothiazoles, that we have oral drenches that go straight into where those worms live. On the avermectin side, we have porons. Okay, we have injectable. So there are a couple of different ways. Some are really long lasting. Okay, and our avermectins, just our basic ones, we can have efficacy out to 28 days or so.
Wow.
Right? Which our other ones are quick hitting, quick acting, and then they go away. So there's no residual effects.
Yep.
So understanding if we need residual, if we don't need residual, what we're after, what previous treatment history is. All of these things go together, and that's where the conversation with the local veterinarian, all producers should have that veterinary-client-patient relationship, ask these questions, have this conversation. This is what I've done in the past. What are my options?
Yep.
What's the best choice going forward?
And I think that goes right in what you're saying too, is that changing class of compound, combination deworming programs are all being built and studied to prevent resistance within your herd.
Yeah, resistance currently, the way we look at it, is if we have reduced efficacy, when we kind of measure that by if what we can do is, measure the worm burden, treat the animals, and then measure the worm burden after. It's called a fecal egg count reduction test, and your veterinarian can run that. But that's a measure of efficacy. And what that means is if we're getting less than 90% kill rate, we're running into either resistant issues or we didn't dose those animals correctly.
Yep.
Okay, so with whatever products we're using, we need to make sure that we are dosing those by weight, that we're actually not underdosing, because if we underdose, we're not going to have the effect, and we potentially could breed some of those resistant issues.
Yep. And we got about a minute left. Work with your veterinarian on when and which animals to deworm, correct?
Absolutely. So, there are differences. And if you're a cow-calf operator, you're on grass, 100% of the time, we're going to do things one way. If you're at a feedlot and those animals go into a dirt lot environment, there's no more parasite burden. Okay, whatever they're holding on the inside, that's all they're going to have.
Because they're not going to be grazing, they're not going to be recycling. So we just kill it, whatever's in them. We don't worry about new ones being formed.
Yep, but time-wise, obviously it's usually when we have those animals captured, when we can properly dose those animals, which isn't always the best time to properly deworm those animals. So our springtime is a really common time. It's getting ready for turnout, and ideally, if we can wait a month or so after we've turned animals out, they can graze and pick up all those new emergent worms. We can get them back in and deworm them. We can really have a good effect there. But it's a challenge with labor.
Yeah, we vaccinate and deworm when we catch them.
Yes.
Well, again, thanks for all you do. Thanks for being on the show. We'll have you back. Dr. A.J. Tarpoff here at Kansas State University. Remember, like he said, always work with your local veterinarian. If you want to see what we do at DocTalk, you can find us on the web at www.doctalktv.com. I'm Dr. Dan Thompson with Dr. A.J. Tarpoff, and we'll see you down the road.
At Merck Animal Health, we're shaping the future of animal health with pioneering science, connected technology, and insights-driven solutions to bring our customers an unparalleled portfolio of choices to improve cattle care and operational efficiency. We support you and your legacy by helping you meet the challenges of today with the innovations of tomorrow.